Welcome to the Fearless Health Podcast with host Dr. Anne-Marie Barter.
Thank you so much, Reed, for joining us today. I'm so excited to have you. So I am really curious because you have been doing this for such a long time. How did you get into health coaching 20 plus years ago?
Thanks, Doc. 20 plus years ago, I was actually in environmental law. So I was saving the planet. I was down here in Southern California, cleaning up the air, water, birds, trees, bees, whatever, saving lives and saving the planet. And what was interesting, I noticed so much dead stuff around. I started wondering, well, what is it doing to people, including me? I didn't have any health problems at the time, but I thought this isn't good. You're sticking your hands in muck, it's killing birds and fish, So anyway, so I changed careers and started to devote myself totally to what is it doing to people. And I found that I went to work in a clinic and I was running the place, but the owner took me, she was getting her diploma in nutrition, and she said, hey, you can come along as my assistant to classes. So I was taking these nutrition classes as her assistant, and this is amazing, Doc. She let me work on her patients in between my classes as a nutritional consultant. And I fell in love with the clinical side of it, just facing Mrs. Smith and Mr. Jones with all their health problems. And they're walking in the door, and I didn't know what I was doing 20 plus years ago, but I really had an intense desire, a really sincere desire to help, especially when almost everyone walking in the door, the most common thing I heard was, I've already been to 5 practitioners. I've already tried 18 different things. I've already spent 10 grand, 20 grand, the stuff. And, as a guy who was trained in law, I wasn't a lawyer, I was a paralegal, but I thought this is a ripoff. I'm a consumer advocate, a planet advocate, a people advocate. And I said, well, I'm going to be the last person you need to see to resolve your health problem. Now was just as naive as, you could get, but heck, nothing ventured, nothing gained. And I had really good access to all the very best, latest alternative lab work, and physicians who were alternative minded. They called it alternative back then. Then it became sort of integrative, and then it became complementary. Now it's functional medicine, and it's really grown and matured in a well-respected field. But back then they were kind of all quacks, but I loved them. And I thought, I'm not a doctor, so I can try anything, and people are willing. And what I did was I run thousands and thousands of labs on thousands of people. I worked there for 8 years doing that. And so not only was I guided really well by some smart people, but I made my own observations. I recognized patterns when I ran these tests, like hormones and immune system, digestion and detoxification, energy production, autonomic balance and things. There's a lot of labs you can run. And so I have, over the years, kind of boiled it down to just a system of investigation, looking at underlying causes, underlying conditions, things that are kind of upstream for where the symptoms are. So I know we're going to talk about skin. Well, I rarely look at the skin. I always looking at something underneath, deep down, or even far away from the skin that can be having an effect, downstream. There's this thing I call metabolic chaos. So over 20 years, I have one diagnosis for everybody. It's called metabolic chaos.
What is that?
Well, it's a state that exists when, let's say, various stressors, like let's start with that environment we talked about. I know how bad it is and how bad it can be, and how ubiquitous these hidden things are. And I started studying stress 19 years ago, really well, about, not just the mental, emotional, but the physical trauma, and then other biochemical and chemical stressors, again, from the environment and things that our body makes. It might not be detoxifying and things. So metabolic chaos is just what I call what's really going on inside. And everyone is so individual, Doc, as you well know. You're a
Mhm.
functional medicine practitioner. Everybody's different. Everybody has different weak links in metabolism, or what you might call vital voids. Now, some voids can't be overlooked. If you're missing a gallbladder, that's a void in vitality and metabolism that you're going to have to support forever. You can't regrow a gallbladder or any other part you have excised, but you can do an awful lot to work around it, and that's how I've based all of my protocols, which is the other half of the equation, and my history, if you will, as we wrap it up here. Not only have I run thousands of labs on thousands of people, at the time, more than any 5 doctors were doing, I was told, offices with multiple physicians, and I was running more labs than that. But the other thing is that the protocols had to be natural, holistic, lifestyle based, and we use supplements, but mostly just looking for those hidden stressors, and then teaching people how to improve their behavior. And to the degree that that can improve someone's health, we have dialed it in, like the path, the what to follow, what to look for, what to follow. It does not replace a visit to a doctor's office where they're trained to find serious problems and diseases, and to save lives and do heroic stuff. So that's a different backyard. It's not my backyard, but it's a very important one. And I
Mhm.
always say to my clients, I jokingly say on interviews that, if you get off a plane from West Africa and your temperature is 105 and you're bleeding from your eyeballs, you're not going to call your nutritionist.
Mhm.
You're going to go get urgent attendant care, where we're the best at that, in America here, I think. And then, or, but when you're out of the woods, then what? Well, now you're in our backyard. Let's do some metabolic healing. Let's make sure you prevent disease and, um, you know, improve health so much that disease can barely exist. You'd have to really get whacked or have an accident, which case, so the two work hand in hand. That's my background pretty much. I've been teaching my system for over 12 years. I was a clinical advisor at a top functional lab for 12 years, in addition to having my own business and things. So I just have a lot of experience and a few things to say.
Okay, very good. So, well, I mean, we know right now is allergy season. Okay, and
Oh, yeah.
it's just everything's blooming and folks are miserable. And so, what is your comment on why certain people really get a flare with allergies during this time of year?
Yeah, well, people have varying degrees and varying types, I would say, of sensitivities to things in the environment. Like the inhalant antigens can present, and you can have an immediate reaction to it. It's mediated by immunoglobulin E, IgE. Most of those are histamine type responses, where myself personally, I'm allergic to cats. So it doesn't have to be any time of the year. It's just, if I start petting a cat, my eyes start watering, I could sneeze, I could get itchy skin, things like that. And so these allergies, the inhalant type things, pollen, and affects you the same way. It's your IgE, histamine, other mediators perhaps, but you're going to have some pretty severe symptoms, including, I've seen people get like the worst hives, just big red patches all over their bodies, in addition to the watering eyes and sneezing and other things. I've seen people have migraine headaches, just triggers migraines. So again, we're looking at individuals with individual responses. Other people can't breathe. They get asthma attacks and what have you. So I think there's a whole complex variety of things going on, but some people are just more easily triggered than others.
Mhm. And why do you think these folks are having high histamine responses or having an IgE reaction to some of these, let's say pollen or whatever it is, a cat? Like, why do you think some people's immune system is so hypersensitive to potentially break out into hives, have a runny nose, feel like their head's going to explode, whatever it is during allergy season for them?
There's some theories on that. It's just the way you're born and things. I think there's a combination of inborn errors in metabolism, and then I think there's also acquired, dysfunction, and a lot of people it's just a combination, and so especially if you sort of only ever treat the symptoms. If you don't at least try to clean up your immune system, this overactivity, then you're going to be always taking just treating the symptoms, which isn't a bad thing, especially when it comes to asthma symptoms, things where you can't breathe. But I've had kids who were like I coached football for 15 years, youth football, and I had kids show up who their mom comes by and says, well, Billy can't make it to practice on Wednesday, but he still wants to play football on Saturday. I'm like, well, he's not going to play Saturday if he doesn't show up to practice. That's the rules, Mom. And what's going on in asthma or migraines or some of these other symptoms that appear due to quote unquote allergies, whether it's the pollen in the air or what have you. Foods we found was large. So we started testing some of these kids and found out that, well, they're actually sensitive to a lot more than just pollen. If we could sort of just quiet down the immune system and remove some of these things they're exposed to, that they just improved a lot. Maybe not completely, but a heck of a lot better. And all I cared about was that they showed up for practice on Wednesday, so they could play Saturday. So if it did that, then I was happy, But the moms are all happy too, and I'm joking about that. Of course, I care about the kids, but you know what I mean. Like so we found that they, in addition to their other sensitivities, had food sensitivities. They loom really large, really large. Anyone who's in that situation where they're overreacting to the pollen or any other inhalant, including cats, dogs, would probably get checked out for food sensitivities. See what other sort of pathogens might be around. Funguses, mold, is huge, and they can even have other sort of pathogens, pathology that's just kind of twisted their immune system enough to where it's overreacting. It's looking at, and then of course you get into the autoimmune conditions, which make it worse. And there's a lot of skin problems in those people as well.
How I kind of look at it, I always, try to explain it this way: is you have a bucket, right? And okay, you're eating foods you're reacting to. You have these things in your gut that are creating something called leaky gut, which is such a buzzword, and I hate to use that. And you have all these other conditions, and then you go outside and you're also reactive to pollen, and it was just enough to get over that line and to overflow that bucket. And so people want to yell at the pollen, scream at the pollen, blame the pollen, and then they want to take some antihistamine to just calm their system down, instead of seeing maybe why the bucket was full and dumping some of that water out of the bucket potentially that could be contributing to all of this. I mean, I think just, I just feel like people look at allergies and they're like, it's pollen, it's ragweed, it's my cat, whatever it is, instead of seeing, okay, crud, like, why is my immune system overreactive, and how do we remove that reactionary piece? So yeah, exactly. So why, and then in the piece, like, so for hives, like, do you have any comment on what you've seen with hives? So somebody's maybe eating a food they're reacting to, maybe it is something outside, and they're getting a hive-like reaction. That's not, I mean, I don't think it's incredibly common. It's somewhat common, but do you have any reasons why some of these people are reacting in such a bigger way, right? Because hives can kill you, potentially.
Sure. Well, I'll just tell you, the first time I ever came across someone with the hives, I didn't know they had the hives, but they were coming in for some treatment in the office. They were going to get some trigger point therapy and a chiropractic adjustment. And I was walking this lady back as the case manager, I knew everybody coming in and going and all these sorts of things. That's where I came across that trial and error thing that I talk about all the time. People just try anything and then it doesn't work. And they go try something else and they try something else. And no one's ever really looking deep enough or far upstream enough or thoroughly enough to identify all the constellation of causal factors. And then not only that, but to apply like all the general principles of health building that need to be applied, and the behaviors and all these different things. So that was my responsibility. But this one lady, Susan, let's call her, walking her back, and I'm like, I could just tell she was down, really down. And what's going on? Hey, what's happening? She goes, oh, I'm just really having a bad day. It's this 40 pounds. I'm getting this extra 40 pounds, and I just makes me sad. I go, well, what are you doing about that? She says, well, I can't do anything because I'm on medication for the hives. And the medication, I've been on it for 2 years and I've gained 40 pounds. And the other day I was at my doctor's office and I said, I'm tired of being overweight. And he basically told her, she said, that you can have your choice, lady. You can have the hives or you can be overweight, because the medication made her gain the weight. And she goes, so I'm just really depressed about that. And that's when he offered me antidepressants. And I thought, yeah, wow.
So
I said, that's the different backyard than the backyard that I work in. I didn't say that, but that's what I would say to you now. But at the time, I just looked at her and I thought, well, did anyone ever try to find out why you get the hives?
Just basic question. Just a basic question.
And her head almost snapped off her neck when she looked at me and goes, what? I said, well, you had the hives, and so you take medication and you gain weight, and now you're depressed, and then he wants to give you these antidepressants. I said, why don't you just find out why you get the hives? And she just didn't have a clue. Like, really? Like, well, how would that look? So it really runs deep and it really affects people's lives. And obviously, if we went further into her case, you'd know that she had other sensitivity, other health problems, and it wasn't just the weight and the medication, things like that. But in terms of getting her, we found out she was very sensitive to eggs and nightshades and a couple other foods. It was only a small handful, but she was eating them every day. And within 9 days of getting the test results back and having to look, don't eat this anymore. Don't even come close to this stuff for a little while. And we'll see what happens. No guarantees. And within 9 days, she was already telling her doctor that she wasn't going to take the prednisone anymore. I'm off that medication. I feel much better. And within another couple of weeks, she had lost some pounds. And she was doing, this is kind of the final part, she was doing 2 things that she hadn't done in 2 years, Doc. She was taking hot showers and exercising to the point of perspiration. Because even on the meds, hot showers and exercising to perspiration would make her break out in hives. So she was a changed person. And I saw things like that over and over and over again. The kids with their asthma, people with migraine headaches, and just you kind of name the condition. So skin is just one thing where there's always an underlying cause or condition. You can't always find out exactly what it is. There's no one test that's going to tell you everything about a person. There's no little device like on Star Trek. Here's your, diagnosis. That doesn't exist. I think we're 50 years from a blood test that will tell you everything we'd really want to know. But so what you can do is look for a constellation of things through the functional lab testing that exists. And when you clean that stuff up, people's lives just change for the better. You can't give any real guarantees because of the complexities in metabolism, but you have some real reasonable expectations. If you do this and this and then this and this, you're going to make some improvements on a cellular level, a tissue level, an organ level, a systematic level, the entire organism. When you clean things up, and I've just seen it. That's not from theory, and that's not from going a weekend course in functional medicine. That's from 20 years of working in the lab, kind of pioneering some of these natural approaches.
Right. So this is really interesting because one of the big drivers that actually helped me find functional medicine was hives. And for me, I ended up, my hives were really serious. The hives actually were swelling up in my throat, and I looked like a creature from Star Wars. And and there was no real treatment for it. Nobody talked to me about anything. I was night after night in the emergency room because the hives were actually restricting my breathing. And so clearly I was deficient in Benadryl because that's all they gave me was just an IV line of Benadryl night after night. And when you're a young gal, you don't know any different. You ask questions, you've been there 7 nights in a row and like you're getting sick and some nights 2 nights in a row. It's ridiculous. And for no one to talk to you about that, and that actually made me pursue this. But for me, like my hives were crazy. It was a crazy smattering of things. I was living in a moldy dorm. I was allergic to eggs and eating them every single day in the dorm food.
Mm-hmm.
I had gut infections. I had parasites. I had chronic candida yeast infection. I had SIBO. I mean, the list went on and on. I had leaky gut, and it just was crazy that my body had dysregulated that much. But when you get to the point of an IgE reaction, that's serious.
Yeah.
Like your body is, some people present it with pain, right? Just exactly what you're saying, or migraines or whatever it is. But I just think that that's a critical piece. There's not this, oh, you have hives, take this supplement and it'll all be better and we can all sit in a circle and sing Kumbaya and you're great, because every person is, different, and you have to really pare down that case to figure out what is causing it and what needs to be addressed. Or someone will come in and they'll say, tell me the foods that I need to avoid. The foods on my food sensitivity test were like eggs, sesame seed. It was ridiculous. It was none of the normal foods that you would have.
Right.
So everybody, has to do their individual treatment and be worked up functionally. So I think that that's really important. So we have, let's say we've got, a dermatitis case, like atopic dermatitis. The common word for this is eczema. So, you've got itchy, dry, itchy skin, patchy. What have you seen contribute to, atopic dermatitis?
There's just so many things, like environmentally, of course, there's the hygiene hypothesis where it's just, a lack of hygiene that you've got, and that's true, same with asthma, eczema. There's other allergic diseases and things like that. But cleaning up the environment can certainly help.
The hygiene hypothesis? I'm not familiar with the hygiene hypothesis.
It's just that your environment is not cleanly enough. You're breathing dust mites. You've got dirty hands. You've got excrement on your hand. Whatever you just filth, things like that. So there's hypotheses like that, and I'm more. I think I'm going a little deeper than that most of the time. That the immune system's involved. That could have been that it was never, like an inborn thing. You could have been born without the microbiome that you need. Without the right microbiome, you become really susceptible, like all these cesarean births and things like that. They're finding asthma and allergies in these children more than in other kids that were born through the birth canal, where they did get the mother's microbiome and all the things. Also, the same thing with breastfeeding and all this stuff, that you need the germs of your mother to boost your immune system. You're born pretty much without much of an immune system, and so you need to develop it. When we were kids, we did play outside, and I think we just built up our immunity better. But then what happens? Well, you might be more subject to some of these pathogens, like real pathogens that come along. There are germs that, parasites, bacteria, funguses, viruses, and things like that, they're more influential on a weakened immune system or a not fully developed system. And then, of course, symptoms would occur. And then the standard medicine way of treating symptoms is to give you antibiotics, which then damage your microbiome even further, and you get even more out of balance. Now you've got just say bigger problems. You end up with digestive issues, and you become orally intolerant to other foods, like lactose intolerant or something. You've ruined the brush border on the villi. Now you're not making the enzymes, and now you become actually nutrient deficient because you're not absorbing your amino acids, your essential fatty acids, your vitamins, your minerals, your trace elements, your phytonutrients, things. So you just end up with this sort of, I think these things happen very, very gradually over time, and there can be a sort of certain points in time that you might be able to look back on and go, oh yeah, everyone else was exposed, but I'm the one that got really sick. Like, well, what? Because you were more compromised. I'm not a pure vitalist. Vitalism is the idea that it's never the bug, it's the host. Oh, it's a weak host. Well, that's not true when it comes to things like Ebola virus. Ebola doesn't care how good your immune system is. It's going to kick your butt. And you don't call your nutritionist or health coach if you get something like that, or some of these other very virulent things. It doesn't mean that a health coach can't be there once you're out of the woods. And by the way, I thought about this when you were speaking about the it's almost an anaphylactic shock. If your windpipe is closing up due to an allergy, you need to see a physician. That's kind of the beauty of working together, what a true complementary practice would be. Physicians can, my friend Tom O'Brien says, if you're drowning in a pool, physician gives you a life preserver. Like, this will save your life, and this will get you over to the edge of the drowning pool, where now you can pick yourself up, you can start doing things at home, especially under the guidance of a really well-trained health coach. I won't be shy. I've been training health coaches for 12 years on the lab work and the protocols and things. And it's remarkable how strong our backyard is, but it doesn't cross the line into medical care. So you needed medical care, you better go get it. Otherwise, we're going to do the background stuff, make you stronger, improve that immune system by working on digestion and detoxification and the immune system, of course. Balancing your hormones can be very, very helpful. Finding out what the hidden stressors are, reducing cortisol, boosting another immunoglobulin. More important than IgE to me is the secretory IgA. Like the main, they say most of your immune system's in the gut. Well, let's work on it. It's a big element.
So can you define, because some of the listeners may not know what secretory IgA is, so can you define that and why that's actually important?
Yeah, well, it's things are more complex than I get to explain. As a patient educator, I try to be very factual and truthful, but it's so complex. You just need to look at it like you have your outside skin. Mm-hmm. And then you have your, gastrointestinal tract, your mouth and esophagus and the guts, and then where things are excreted and all that. There's another skin that lines that's 1 cell thick, but and by the way, in terms of the gut, it has to let food in, but it has to keep bad things out, germs and such, right? Mm-hmm. So that's called your mucosal barrier. So, and it's not just, it's in the vagina and penis, in your eyes, the conjunctiva of the eyes, and in your sinus cavities and things like that too. So you have this mucosal barrier. Well, mucus, there's, let's say in the lining of your stomach, there are little cells that release mucus for lubrication. There's other ways that these immunoglobulins, these defense molecules come out, and they hover. They look for things that are that the body perceives as being dangerous. Like, we just call them germs, mm-hmm. And so germs, we're able to handle a lot. You can eat germs. Your stomach acid, if you have good, strong stomach acid, like you should, actually starts with chewing in the mouth, the mastication and the alkalinization and the enzymes that are in starting in the mouth. Then it goes, down the pipes, and acid should just kill just about anything. If you drop a worm or bugs in hydrochloric acid, they die. So most things get killed there. And then in the small intestine, there's even more, like really refined ability to defend you against these bugs. Even the bugs that live there. They say there's more cells that aren't us in our bodies than there are cells in our bodies. It's very interesting how this microbiome works. So you have all of this bacteria living in your gut and in your colon, and it's in other areas it's on you, and it's actually, a lot of it's very friendly. You need it. You need it to help break down food and digest your food, and other reasons. It produces products that help you detoxify, and very interesting. So secretory IgA it's IgA, immunoglobulin A. There's A, and there's D, and there's M, and there's E, as we mentioned. And they all respond in varying ways to varying pathogens or bugs and other nasty things. But SIG-A is a huge one. I think it's the most abundant immunoglobulin in the body. And it's the reason they say that the gut is like 80%. Mark Hyman says the gut is 80% of your immune system. I have a hard time arguing with that guy, because I've seen people clean up their gut and their immunity returns. All of a sudden, they're not getting colds and flus every time it comes around.
Yep. And so with, I think a lot of folks that I hear in practice, I'm way into chemicals. I'm way into chemical exposure, environmental exposure, whatever it is that can be causing it. In fact, I had a case with high blood sugar that was actually related to a sewage line leak, as well as mold, as well as high levels of radon. So I'm like huge into environmental piece. And then that started to stabilize the blood sugar, and all sorts of problems started to go away once you remove that factor, right? And obviously we worked on everything up to that point. But I am a huge believer in, chemical exposure. So where do you think it's just, I'm assuming you think you walk outside, you're exposed to probably 70,000 chemicals every single day. Do you have other chemicals that you really watch out for, other than just, what we're breathing in, mold? Are there other things that you're concerned about?
Yeah, all the time. As we work with a person, we'll usually do some testing for things like food sensitivities. And the reason we do that is because people have them, and when they eliminate those foods, things just kind of quiet down. There's less irritation in the body, there's less inflammation in the body. With less inflammation, sometimes bacterial load will go down. Bacteria loves inflammation. It's easier to treat and things like that. So then people feel better. But they also heighten their awareness, their self-awareness of, wow, things matter. Like, if I eat that food, I'm going to get the hives or asthma or, a migraine or something. Maybe not that drastic, but because the symptoms could be a lot less severe. But they become, again, more aware, and they start thinking, well, what about my household cleaning products? Could some of those be causing the same thing? A lady who cleans her house every Friday afternoon and every Friday night or Saturday morning has headaches. Well, maybe that's trying to tell you something. 1 + 1 still equals 2. And so then they become aware of those things. Then also personal care products. I mean, it's just horrible what they'll put in a personal care product, that just is not good for you in many ways. There's hormone disruptors. There's things that are just sheer irritants, and they're very antigenic. They generate antibody production in your body, and that causes symptoms to occur. So now we start looking at, we've run food sensitivities. We start looking around the rest of the environment, even new furniture. So you look at household care products, your personal care products, new furniture. The kids' clothing is so full of fire retardants that if they have any sensitivity, there's like sort of, you're less sensitive and then you're more sensitive. And, again, some of it's inborn extra sensitivity, some of it's acquired from what happened since birth, and on and on. But, you start becoming more self-aware, more paying attention, and even to where you live. I live up on a hill over a lake with nobody around, kind of lonely these days. but you know, it's
Mhm.
cleaner and less exposure. Again, coming from the environmental field, I pretty sure I don't want to live in the city, you know, and these kind of things. And not everybody can move out, but there's you can mitigate, you can look around, and
How
that's
do you
not even to
mitigate?
mention electro.
Yeah, how are
Yeah,
you mitigating?
well, I have, for instance, for electromagnetic frequencies, I have been using these things in my house. I had my whole house done over. There's stuff that sort of scatters electromagnetic frequencies, and that way they don't have their same effect on you. I don't use anything that isn't natural in my, you know, for washing my clothes and cleaning my dishes and taking showers and all these things. I always check the ingredients really well. A great website for this is the Environmental Working Group's
Mhm.
website. That they have the Clean 15 and the Dirty Dozen. Every year it changes the foods that are like the worst, most toxic, full of pesticides, herbicides, rodenticides, and you know, fungicides, and oh my God, what they put on our food, you know. So the Environmental Working Group, I think it's ewg.org or
Mhm.
.net.
It's org.
Yeah, that's a great one for all your listeners to check out. You know, become more self-aware and more aware of what you're exposing yourself to.
Awesome. Was there anything that I didn't ask about that you think's important? Mhm.
Hey, you mean in terms of health and health building? I
Well, if
think
there,
that
yeah.
people, you know, there's not much more important than diet to
Mhm.
an ordinary healthy person who wants to stay that way and fight off aging and things. You could start before that with the innate intelligence in the body that wants to heal. You know, like there's you don't have to teach any cells what their job is. They know. They work with each other pretty well. They all try to get along, you know, and it's usually some contributor to, I call it those contributors to metabolic chaos, influences that would cause disorder and dysfunction, and they're usually pretty insidious. So you know, food is huge because it's full of crap that will harm you over time. Even if it's just real food, you can have the blood sugar issues and all this. So food, rest is incredibly important. There's little that's as good for your health as getting a good night's sleep every night. It's just amazingly restorative in so many ways. And then of course exercise. Everyone knows sitting, which I'm doing right now. I'm sitting up straight. Um, Sitting is the new smoking. You got to move your body, and we're so, you know, working at our desk, and then we're weak, so we go home and we just sit and whatever, you know, we're not doing enough exercise. So diet and rest and exercise. Stress, again, I've been studying stress for about almost 20 years in every form. We mentioned some of the chemical stressors with mental emotional stressors. I think there's existential angst, spiritual things going on. That's an important area. And then supplements, you know, I really think, I don't have my own brand of supplements, but I know a lot about them. I don't sell them, but I teach people a lot of what's different ways to use them. I think they're really important. I take plenty, you know, because food just isn't good enough. And you know, I'm a little older. I like support in certain areas, just you know, for mental clarity and energy and things like that. You can make up for a lot of ills in the world with diet, rest, exercise, stress reduction, and supplementation. That spells DRESS, DRESS. It's one of our
Mhm.
formulas for health success.
Mhm. Awesome.
Is that enough?
And yeah, that'll do it. Is there anything that you haven't mentioned that you do every day that you think is really contributing to your health?
Well, yes, sister, I sure can tell you that getting up every day and trying to be happy, you know, and trying to make a decision that I can't change the world the way it is. I mean, I'm making differences in people's lives. That's not what I meant, but you know, it's how you respond to it that matters. It's really your point of view, and being grateful and having an abundance mentality. And
Mm-hmm.
I think I was partially born this way, but I just think tomorrow's going to be a better day no matter what. That
Mm-hmm.
every tragedy and discomfort or something I didn't like passed, and it was gone. And really a lot of it is just how you think about it. So, you know about the placebo effect, everyone does.
Mm-hmm.
There's also a nocebo effect, you know. And if you get up every day telling yourself it's a crappy day, it's probably going to be a crappy day,
Mm-hmm.
you know. So don't do that.
Mm-hmm. You definitely will bring in what you believe. That is so true. All right, where can people find you if they want to get in touch with you?
Well, probably the website would be best, functionaldiagnosticnutrition.com. Let me just check and see if there's, I didn't get anything special. Yeah, just functionaldiagnosticnutrition.com. I tried to think of a longer name for it, but it turned out to be that. Just the way it's spelled, you know. And if you go there, you'd learn about where we've been, where we're going, and how we help people.
Awesome. All right, well, thank you so much for being here.
Hey, Doc.